So I wanted to chat through the urge wave number one, urge wave number two scenario that we had talked over a bit. Now we talked about how on the first urge of when we first feel like we have to go pee, we really should wait until that urge dips down and until we hit that second urge. Now, just to explain here, again, we talked about how in this period here we have a calm zone. So again, you should feel your first urge. That's when your bladder is not quite full, right? That's our false urge. We should be able to wait it out, get into that calm zone. And then when we have to go pee again, when we get that second urge, our true urge, what we should do is wait until we hit a calm zone, or I should say maybe a calmer zone, right? Where if I acutely, really urgently have to go pee and I'm like, oh my gosh, I might have leakage, or my nervous system, my sympathetic fight or flight nervous system turns on, and I'm like, I don't know if I'm going to be able to hold it. We want to employ some strategies to, in the short term, calm our nervous system down so that we can calmly walk to the bathroom. So this here is not long, right? We don't want you to wait another couple of hours until you hit your third urge, but what we're looking to do is when our sympathetic nervous system, again, fight or flight is at its peak right here, we just want to employ a few strategies where we can take a couple of deep breaths. So we can do a diaphragmatic breathing, right? So like putting your hands right on your rib cage, taking a few deep breaths, right? Run through that a few times, as we talked about before. So we can do 360 breathing strategies. We can also do like heel or calf raises as well, where we can take a few breaths and we can just run through lifting those heels up. You can try like 10 of those or until the urge starts to dissipate a little bit. Again, you could short-term distract yourself by counting. So you can count, from backward from 100 by sevens or five, whatever makes sense for you, as you are calmly walking to the bathroom. So when we get into a situation where we urgently have to go pee, and again, we're fearful of leakage, if we go and run to the bathroom, that's like giving, again, your bladder control, right? Versus you having control of your bladder. So I love to use the example of like a kid in the grocery store where you're about to check out and they're screaming for, let's say, the candy that's right at their level, right? You could just give it to them every single time, right? And it calms them down. But what you're doing is essentially giving that child, kind of control of that situation. And so as a habit, if it happens over and over and over and over again, then they know that when they're in that situation, that they're going to get what they want, right? So our bladder, we want to be able to have control over our bladder and not allow our bladder to have control over us, right? So employing these strategies can be super, super helpful. So give this a try. And again, see if you can listen to your body, wait until that true urge, and then use a few strategies to calmly walk to the bathroom and see how it goes.